Dr. Karina Iregi here from Pittsburgh Dental Sleep Medicine. I'm going to review the use of a device called a leaf gauge that will help you reestablish your bite after using oral appliance therapy. So using the leaf gauge is the most effective and efficient way is going to be the key to being able to obtain advantage by going through these exercises. I want you to kind of think about this as physical therapy for the jaw, so to speak. So this is our device called a leaf gauge. It's basically just a tab or a stack of plastic tabs. You're going to take the whole stack, place it between your upper and lower front teeth, and bite down. Now, I'm going to move my jaw as far forward as I can and as far back as I can. I'm going to do that 3 times. Once I've done it the 3rd time and my jaw is as far back as I can get it, I will then clench. 3 of the key things: you want to move as far forward as your jaw can, but gently, as far back as your jaw can go, again, being very gentle, and then you want to clench without sliding your jaw forward. So it looks like this. And then clench. And then forward, back. And clench. Forward. And clench. So forward and back, forward and back, forward and back, and clench, I consider 1 set. You're going to do 3 sets. Once you've done the 3rd set, you're going to take away about 5 to 6 tabs. And you repeat. Forward, back. And then clench. And clench. 3rd time. And clench. Remove the leaf gauge. Subtract about 5 of the tabs. You are going to continue to do that until you get down to as few tabs as you can hold between your front teeth. You then repeat and then clench. That's the 2nd time. Third time, clench. Once you've gotten down, I really probably couldn't hold less than that between my upper and lower front teeth without losing the leaf gauge. So once you've gotten down to that few tabs, you're done with that session. I advise my patients to do this whole procedure starting from the full stack, going through each cycle, forward and back, forward and back, forward and back, and clenching, doing 3 sets, removing 5, 6 tabs, and then doing the larger stack. Each time, 3 sets, eliminating until I get down to very few tabs. At that point, you're done again with that version or that set of exercises, and you're going to repeat that 3 times a day. Again, this is doing is bringing your jaw, as you're removing the tabs, you're bringing your upper and lower jaw closer together, enabling those muscles to move a little bit further forward and a little bit further back, allowing that jaw to seat in its most posterior position or back position, allowing those back teeth to hit and regain your bite on your back teeth. I cannot stress enough that this needs to be done gently. This is a joint just like any other joint. So when you're doing physical therapy, you want to be gentle. You don't want to cause trauma to the joint, which will then set you back in using your oral appliance. So I'm stressing that I need this to be done very gently, and you don't want to rush it. So I almost talk to my patients about it being like a metronome: forward and back, forward and back. Again, keeping in mind that you want to move as far forward as you can, gently, as far back as you can, gently, and then when you go to clench, that you're not sliding that jaw forward. Those are the three things that I see people, when they use a leaf gauge, decrease the efficacy of this kind of physical therapy because they're not moving their jaw in that full range of motion. Hope this helps. Use your leaf gauge. Call if you have any questions.